So contrast that with what we see in terms of our society right now in terms of deaths. Tobacco, alcohol being the biggest ones. When I worked at the World Health Organization and there's a Department of Substance Abuse, our biggest initiative at the time, it wasn't opioids, because that wasn't really a problem back in '99. It became a problem. I recognized the problem in '99. What I recognized as a problem in '99 was this stupid drug called OxyContin, and the way it was promoted, where major hospitals, even to this day, a lot of those people still work there, and they said OxyContin's not addictive at all. But we all know better now, right? What was interesting when I learned at the World Health Organization is a lot of countries, a lot of sort of the third world countries truly thought and think that alcohol and tobacco are really not bad. They did not think that they were addictive. They did not think that they caused any problems. And part of that was because it was rooted in the culture of those societies. Even though a lot of people were dying from these products on a daily, yearly basis. In America alone, we see about 500,000 deaths per year due to tobacco. Alcohol is estimated at 125,000 deaths a year. Honestly, I think alcohol is way underestimated. Addiction rates, they say with tobacco, is about 33%, about a third of patients, and actually some of the medical literature would actually not support that. They would say that nicotine is actually the most addictive compound, more addictive than any opioid that's out there, and then that's backed by science. So if you look at that, you could say arguably it has an addiction rate almost close to 100%. So these are some surprising statistics, yet this is completely legal and people do this all the time. And when you contrast that with marijuana, which isn't legal and doesn't have this rate of death and doesn't have the same type of addiction that alcohol and tobacco have, you start wondering where did we go? Where did we go wrong here? How did this happen? You almost wonder what would have happened if we had a time machine and we would have made marijuana legal and would have controlled alcohol more. Would we have less DUIs? Would we have less bar fights? Probably. I mean, like everyone would fall asleep at the bar, right? They would. That's what a bar would look like. It would be a place where they would have cots and things because everyone would fall asleep, as opposed to get angry and start bar fights. So kind of interesting when if we could see a parallel universe and see what would have happened if we would have done things more scientifically. But yeah, so with marijuana, we just don't see that same rate of addiction and death that we see with other products. I will get to this. That doesn't mean that marijuana has no addictive properties. We'll talk about the psychological thing in just a few minutes. And this is something that we definitely need to talk about. Sometimes not the most popular thing because you have two sides sometimes of the pendulum, which is all for and all against. But let's take that scientific road right in the middle and talk about what the facts show. So marijuana pharmacology, we discovered in CBN, cannabinol, we discovered that in 1895. Cannabidiol, CBD, discovered in 1934, and THC discovered in 1964. So some of the pharmacology that we see with cannabinoids, we find that they're present throughout the plant. Okay, they're in the stalk, the leaves, the flowers, the seeds, the hash or the resin, and is secreted by the female plant. After oral intake, blood concentrations can reach 25 to 30%, and of those obtained from the smoking route, okay, the same dosage. The onset is delayed, could be anywhere from half an hour to 2 hours, but the duration is prolonged. And once it's absorbed, THC and other cannabinoids are rapidly distributed and accumulate in fatty tissue. Remember, these are all fatty products, okay? These are all fatty oil products. So it's very dependent on fatty tissue and fatty reactions. Some of the enzymes that degrade these molecules are enzymatic reactions specifically in the fatty system. Elimination half-life is about 7 days and completely eliminated in about 30 days, which is why on urine drug screens we'll still see things like THC for up to 30 days afterwards because it's stored in the fat. Metabolism is in the liver, and this is important. Cannabis, marijuana, let's just say, or cannabis of any kind, but marijuana, can cause your liver to become loaded. And we've actually seen this clinically. We've seen patients who are fortunately off of all of their other medications because we've been able to help them through a variety of techniques, including medical cannabis. However, their liver enzymes have actually gone up. We had a patient like this literally last week. So it is something that physicians need to know about, your healthcare providers need to know about. They need to follow up, as patients also, you need to follow up with, if you're on medical cannabis, I would say at least, every 6 months or so, get liver function tests. We have seen this, and I don't think it's talked about enough. again, it's a chemical, it's a compound, right? Just like any other compound. If you have a compound that you're taking and it's metabolized by your liver, or let's say your kidneys, or it's loading your kidneys, you need to have that checked, right? Because these organs work hard to metabolize or to excrete these products. So liver is metabolized in the liver, and definitely liver function tests should be done, especially on patients who are consuming these products on a daily basis or often.